I'm joined now by Senator Brian Schatz, Democrat from Hawaii. And Senator, you know, it's been interesting. You look at the town halls and you see that people are showing up clearly angry and terrified, frankly, that they're going to lose their health care. And on the other hand, you have people like Congressman Dave Brat, I believe he's from Washington State, who is positively giddy about the idea of repealing the Affordable Care Act, saying it's a conservative principle. 50 laboratories, 50 experiments going on simultaneously. You can see what works and doesn't work. He's talking about ending community rating, essentially ending the requirement that insurance companies have to not charge older people more than they charge younger people, ending those requirements in the packages. I don't understand what Republicans think people want, but do you detect any desire out there to go back to that old system?
Well, I think that they spent so much time using Obamacare as a foil that they forgot to formulate a policy. And so here they are in charge of both chambers, in charge of the executive branch. And it all fell apart really quickly, actually without our intervention as Democrats. We didn't have the votes to intervene. They didn't approach us to intervene. And yet it all collapsed within because they were lying for the last 7 years. The truth is that what Donald Trump and many other Republicans said for many, many election cycles is you could get rid of the bad stuff and keep all the good stuff. But the truth is that to the extent that the bad stuff is revenue, you need that revenue for taking care of people with pre-existing conditions, for community rating, for people being able to stay on their parents' plans until they're 26 years old. So all of the things, all of the protections of the Affordable Care Act had to be arranged by virtue of revenue and by virtue of regulations. And now that they don't have President Obama as a foil, this thing fell apart, and it fell apart quickly. So you still have 20 or 30 members of the House who are so ideological that they're willing to inflict pain on their constituents, but the rest of them are just running scared, trying to figure out how to fulfill a campaign promise that nobody wants them to fulfill anymore.
Right, and I put Dave Brat in the wrong state. He's not in Washington State, he's in Virginia. But, you know, you've had now Senator Ron Wyden come out and say, we're not going to negotiate with hostage takers. That was the quote in the Washington Post, Ron Wyden saying, nope, not going to negotiate with Trump if he's trying to take hostages. But behind the scenes, would Democrats cut a deal with the White House if Trump dropped repeal and said, okay, let's do an Obamacare fix instead and call that Trump care? You think Democrats would go for that?
Well, so it's a good question. So I think there's two things. First of all, to the extent that Donald Trump is threatening to withhold money from insurance companies, which will harm individuals across the country, which will make hospitals and hospital systems fall apart. If his threat is essentially, I'm going to inflict pain on people and destroy the American healthcare system, or I'll do it with you, we're not going to negotiate under any circumstances like that. Now, what we have said all along is if they officially drop their proposals to destroy the Affordable Care Act, and we talk about iterating legislation and working on a bipartisan basis. Everybody knows ACA doesn't work perfectly, but everybody also knows that for any major social legislation that you iterated over years, that whether it's the Social Security Act, the Medicare Act, whatever it may be, the Clean Air, the Clean Water Act, you have updates to that law. This is one of the very few major social changes that had no updates into the statute, which is why it's a little clunky. If they want to get back to legislating in good faith, we are more than open to that, but they have to drop repeal from their vocabulary.
And how far are Democrats willing to go? If Donald Trump withdraws from, this was essentially a lawsuit that the House Republicans brought saying that the subsidies to these insurance companies were unconstitutional. At the moment, it's on appeal. Trump could just say, we're not going to fight it anymore, we're just going to stop paying. How far would Democrats go? Would they allow those subsidies to go away in order to stand to this position of not participating in repeal?
Look, this is Donald Trump's decision. I think he's threatening the American people. I think he's also threatening the legislative branch. And one thing that he hasn't figured out is that legislators don't like to be bullied. You know, he's not in real estate anymore. He's sort of trying to treat members of the United States Senate who are former governors and admirals and astronauts and, you know, TV stars and people with, you know, substantial egos and substantial support in their home states. They cannot be bullied. They will not be bullied. And this idea that you can sort of treat members of Congress, a co-equal branch of government, as though we're sort of a subcontractor in a real estate deal that he wants to stiff. It's one of the reasons that he's been such a failure so far as a president is he doesn't understand understand that we have 3 co-equal branches of government and that the legislature, the legislative branch, is not going to around. So especially on this, we're not going to allow him to hold the American people, the American healthcare system hostage and negotiate under those terms. Now, if he wants to improve the Affordable Care Act, we're all in.
Yeah. It is a co-equal branch of government. I think Donald Trump might be learning some Civics 101 in his 84 days as president. Senator Brian Schatz.